Affecting over 300 million people worldwide, depression is the leading cause of disability, as well as one of the top global burdens of disease. Depression limits a person's psychosocial functioning and in turn negatively affects the quality of their life. In the case of major depressive disorder, also known as MDD, it is estimated that the lifetime prevalence rate in the United States is over 16%. MDD is one of the most common psychiatric diseases, with those reporting their ability to maintain self-care and independent living being inhibited. One of the most common treatments for MDD is medication. Although the use of medication for the treatment of depression began in the 1950s, it has increased due to the development of drugs such as SSRIs, Prozac, and Zoloft. These drugs have no better effectiveness on the treatment of depression, they only have fewer side effects. Although the side effects have decreased from the medications developed in the 1950s, the side effects are still prevalent. The side effects of SSRIs include loss of sexual interest or functioning, nervousness, headaches, gastrointestinal complaints, drowsiness, and insomnia. Ironically, some of the side effects of the medications used for the treatment of depression are symptoms that are reported with MDD. Due to the side effects reported with the medications used for the treatment of depression, it is important to look at other forms of treatment. Studies have been done to find a relationship between individual nutrients such as vitamin B, omega acids, and folate and their effects on depression. But the human diet is very complex and contains many nutrients that interact with one another. Studies examining dietary patterns seem to have a more comprehensive approach on the relationship between diet and depression. The Mediterranean diet, MED diet, is one of the most studied dietary patterns. It includes the consumption of olive oil, fruits, vegetables, legumes, and fish, with limited amounts of dairy and red meats. In a recent study with 500 participants, 250 adhering to the MED diet and 250 in a control group with no nutritional intervention. All 500 participants were over the age of 18, have had one or more major depressive episodes within the last 5 years, and have had no major depressive episodes within the past 6 months. This study is focused on if adhering to the MED diet had an effect on the reoccurrence rate of depression. All participants began with a baseline assessment and questionnaire. Every 3 months, the participants had a phone meeting with a dietitian during which they discussed what they ate, physical activity, and other key factors in regards to socioeconomics and lifestyle. Every 4 months, the participants had the option to have another phone interview with the dietitian or to take an online questionnaire about their depression. Lastly, they had a yearly clinical follow-up, identical to the baseline assessment. After 2 years of follow-up, the study showed that 50% of those in the control group had a reoccurrence, whereas those in the MED diet only had a 35% reoccurrence rate. All in all, the study makes a very strong case. They did, however, tell the participants of the purpose of the study. This could lead to a bias, since the participants know what the researchers are looking for and in turn could base their answers off of that. Studies have shown a relationship between pro-inflammatory markers and the onset of depression. Around a third of those depressed show higher inflammation in comparison to those without depression. Many of the symptoms of depression, such as loss of sleep, also lead to an increase of inflammation. This means inflammation increases the risk of depression, and in turn, depression increases inflammation. A systematic review and meta-analysis done on the effects of an anti-inflammatory diet and depression showed a significant association between a pro-inflammatory diet and an increased risk of depression. The analysis included 11 studies with over 100,000 participants with ages ranging from 17 to 72. This showed that adhering to an anti-inflammatory diet could help the risk of depression, with depression being the leading cause of disability and the prevalence rate continuing to increase even with the development of new medications. it is important to look at new treatments and how diet could potentially affect the reoccurrence and symptoms of depression. Sorry guys, I'm sick, so if you heard sniffling, and I'm also outside, so if you heard a ton of background noise, that is why. Thank you for watching my video and listening to my presentation.